After months of consultations and negotiations, Kenya and the United States have officially signed a 5-year strategic objective grant agreement that formally paves the way for the implementation of the two governments' health cooperation framework, expected to mobilize at least 207 billion shillings to advance Kenya's universal health coverage agenda. It is now official that all the US funds will flow through the national treasury, unlike before when PEPFAR funds will bypass the central government coffers. But as Gloria Milimu reports, experts now warn the move has ramifications that contradict the very purpose it is meant to serve: streamline accountability structures. Take a look.
Months of meetings between the United States government officials and their Kenyan counterparts regarding US President Donald Trump's strategy around global health officially culminated into the signing of the Strategic Objective Grant Agreement that now sets the pace for the implementation of the Kenya-US Health Cooperation Framework. Unlike before, when US funds for various development initiatives will bypass the central government coffers, the new health framework that takes a government-to-government cooperation approach will now flow through the national treasury.
From the national treasury, all the disbursements goes to MOH, to the SAGAs, to the county governments. So there's a whole architecture.
Previously, the kind of arrangement that has been that we had some challenges on our part.
Even so, experts argue that the US government shift that bypasses previous accountability structures like non-governmental organizations is likely to create accountability leakages that will in turn impact on health service delivery due to lack of third-party accountability.
There's an assumption that we stopped all health assistance last year. So when we paused it, we actually unfroze all of the health assistance. So we still have ongoing health programs before this new program is launched of about $400 million a year.
And it's important for them to make this transparent and public because it'll then help in playing an accountability role to know what has our government committed to, what is the US government supporting, who are the implementing partners.
Previously, central government officials, including ministries of finance, had little to do with planning and operations related to US-supported health work. Kenya, whose Transparency International Corruption Perception Index continues to draw concern, will now see its leaders control at least 207 billion shillings that US President Donald Trump's administration has allocated to support the country's health agenda and advance its transition towards a resilient, self-sustaining healthcare system for the next 5 years. Concerns regarding how the government plans to address corruption and prevent diversion of these resources continue to linger, and now stakeholders in the health sector maintain that leaders must be held personally responsible for any shilling that will be unaccounted for in the new co-financing framework.
The accountability and transparency around this funding will be guaranteed. We are actually carrying out a number of reforms in terms of accounting for donor or development partner funding.
We are yet to see what are the accountability frameworks that will be put into place to be able to hold the players accountable, not only say on the usage of the funds, but from a point of view on what has been committed in terms of delivery of services, the type of services, and whether actually those services get to the people who are supposed to get it.
US began bilateral health negotiations with at least 16 African countries, engaging directly with countries as opposed to through implementing partners. Kenya is the first African country to sign the historic government-to-government health cooperation framework with the United States. The agreement was officially inked in December 2025. Gloria Milimu, KTN.
Still on matters health, now as the Ebola cases